Hi, everyone. This is Cynthia Rice. I'm hoping that you can hear me. I am welcome you all to our session 2 live Q&A, Childcare and COV, COVID-19 state and federal supports. We're happy to be here in this second session where ACNJ is partnering with our colleagues, the New Jersey Association of the Education of Young Children, the Coalition of Infant Toddler Educators, New Jersey Head Start Association, New Jersey Family Child Care Association, New Jersey SAC, our After School Coalition, and the New Jersey Family and the New Jersey Business and Industry to come here to help support our childcare community and families as we move forward through this pandemic. Today we have 2 wonderful panelists, Kim Pirelli, who's Vice President of Childcare Aware New Jersey, and Charisse Ritter, who is the Managing Director and Practice Leader for Nonprofit Service Groups at Mercadian, and is co-collaborator with the New Jersey Business and Industry. So I thank you all for being here. And let's start right now because there's so much information to cover at this time.
Thank you so much for inviting me to participate on behalf of the Child Care Resource and Referral Agencies. Again, my name is Kim Pirelli, and I'm representing the state network that represents all of the Child Care Resource and Referral Agencies, or CCR&Rs as we call them, statewide, so all 21. And I'm also here, representing our partners who are also our funders, the Department of Human Services Division of Family Development. So lots of things happening, evolving. It feels like minute to minute, hour to hour. So information is coming fast and furious, and I hope that I can make sense of some of this for you. So the Child Care Resource and Referral Agencies are a key player in connecting families with emergency child care programs. The New Jersey Department of Human Services Division of Family Development and the New Jersey Department of Human Services Office of Licensing have put in together an emergency assistance system, to be the support body for individuals who still have to work during this, during this emergency. And so some things that I think are important to know, that the Department of Children and Families authorized close to 600 emergency child care centers. They are authorized to remain open, but only to serve essential personnel, which we'll tackle in a moment, who we mean by that. Many registered family child care homes are also remain open, but the availability differs by community throughout the state. And again, as your child care resource and referral agencies in each respective county, we are here to help and support the child care needs. To best serve essential personnel, the New Jersey Division of Family Development is working to help meet the costs of child care for those that are defined essential and have to go to work. And so I understand that this PowerPoint is going to be shared, which is wonderful, so you have the information. So I won't read it line for line, but who we're considering essential workers are healthcare workers, first responders, essential social service workers, government employees who are unable to work from home, and critical retail workers such as grocery store and gas station employees, as a couple examples. Next slide, please. Okay, so how do essential workers get connected with childcare? So there is a link where essential personnel can apply for assistance. That link is live, but I'm going to tell you the website is childcarenj.gov/emergency. And that link will connect you with a simple form application to help you get approved. We have to determine, if it's meeting the essential worker criteria, and it will directly connect your application with the CCR&Rs in your respective county. Okay. As far as the child care financial support, that will be paid through April 30th, but they're considering policy right now in terms of longer term closures, but it will be reassessed. And the way information is coming at us, we're going to take it sort of 1 month at a time, and further policy for longer term closures are being considered. Just a couple things around the financial support. If you are a parent that is currently on the child care subsidy program, receiving financial assistance, and you are an essential worker, you are eligible for it, and your costs will be fully covered by the state. Just want to point out that during this global crisis, there is emergency center rates that are not that are higher than typically paid out. Let's see. And then for all other families, that are essential workers that might not be on our currently on a child care subsidy, child care will be paid at those same rates. There is an option for emergency child care programs to charge above their rate, but it cannot exceed 10% of what they were charging in February of 2020. Okay, so I hope that's easy. I hope you can follow that. So let me just recap. Families currently on a child care subsidy or are eligible for it, we might deem that families that are currently not on the subsidy program, but based on some information that we're going to be assessing, you might be put on the child care subsidy, and those rates will be covered. All other essential workers will have child care paid for them at the rates you can see, the emergency center-based weekly rates, up to those costs based on the child's age. Also to the right, you can have a link to the childcare.gov website. That's a live one. You can click to access the Division of Family Development's information. Next slide. Okay. And currently, the New Jersey Child Care Resource and Referral Agencies are working closely with our partners, the New Jersey Division of Family Development. We are in daily contact with them to assess how the system is working, to determine family needs. They want to better understand how we are able to connect families to what their unique needs are. So we are in regular contact with our funders, and also working closely with the New Jersey Department of Children and Families. And again, in contact with those that are designated as emergency child care centers, those registered family child care homes that are open, and of course, families of essential personnel, connecting families with child care programs that meet their unique needs. Which could be a family working a non-traditional hours, a 3 to 11 shift, right? Looking for, programs that would support something where they might want a program with their very young baby, with their infant. Maybe that's a registered family child care home in a smaller setting. So I just want to reiterate that, as your local child care resource and referral agency in each county statewide, we are here to support the child care sector and those families that have to go to work during this pandemic. So we are your resource, and we will continue to be through this and beyond. I would also recommend on some of these links, there's also some guidelines for child care programs for following the CDC guidelines, and what explanations on social distancing and how to keep children healthy and safe.
Hi, everybody. I am Charisse Ritter, and I am a principal at Mercadian PC CPAs. I am the co-leader of our nonprofit and human services group for the firm, and have spent the last, as Kim was saying, spent the last week or week and a half really managing a lot of incoming information about what resources are available, not just to our not-for-profit clients, but also our for-profit clients for the firm and friends of the firm. So last week, I was a panelist for New Jersey Business and Industry Association, and where I talked about Mercadian's sustainability checklist for not-for-profits. So when this began, we put together two sustainability checklists for clients and friends of the firm. There's a nonprofit sustainability checklist and also a for-profit sustainability checklist. And we thought that it was critical to do the two different checklists because not-for-profit organizations, some of which you may be in the audience today, have different nuances to their operations from for-profits. So what I want to say at the beginning is we have numerous resources on our website, which is at www.mercadian.com. And we have tools and information, a portal where if you need additional information or you need assistance with regard to determining, what resources are available to you at the federal, state, and local level, please feel free to make an inquiry, and somebody from our task force will get back to you. So just to go over the sustainability checklist, first, I think it's really important that everybody that is, impacted here, which is pretty much everybody, to try to stay calm, because that's key. And so in terms of determining how to move your business forward, there's a few things that you should be thinking about doing between now and the first critical date is June 30, 2020. In terms of taking advantage of some of the programs, and then also beyond June 30, because honestly, I don't have a crystal ball, neither do you, and we just don't know how long this is going to go on, and how long each of us are going to be impacted in different ways from the pandemic. So what I'm counseling my clients to do is to gather their financial information and do a cash flow projection to determine where they think their cash flow is going to be and what it's going to look like between now and June 30. So we're sitting here in April, and we know that in the state of New Jersey, we're quarantined until April 30th at this point. So thinking fast forward, if we're quarantined until April 30th, we're probably not going to be up and running, and many of you are, but some of you may not be. We're not going to be up and running until the middle of May. And then fast forward to June 30, where are we going to be within that time frame? Because some of the resources that I'm going to talk to you about are how you're going to spend dollars that you receive through a loan, how you're going to spend those dollars to get them forgiven. So you prepare your financial projection and determine what your cash flow gaps are. And there's a number of different things that you should be thinking about doing, including should I be deferring some of my payments? Are there, and when I say defer, that means I'm going to eventually pay it, but I'm going to slow down or defer what's due. Maybe it's a lease, maybe it's a mortgage payment. There's a lot of opportunities out there right now where you will not be penalized for late or no payments, including payroll taxes. The other thing you might want to do is talk to your key vendors to see if they're willing to accept the payment plan, or just tell them what you can and can't do at this point in time based on your cash flow projection. Then what you want to do is you want to take a look at cutting expenses. So to the extent that you need to think about downsizing your workforce and just minimizing your overall expenses, that's the next step. And then you're left with your final gap. So you've cut your expenses as far as you can cut. You've delayed the expenses as much as you can. And so now it's time to look and see if, what type of loans or grants are available to you. And so we have been working with many of our clients to help them take advantage of the Paycheck Protection Program. That is a program that is being implemented by the SBA, the Small Business Administration. And actually, there's 3 programs right now that that you can take advantage of from the SBA, including the emergency grant, the EIDL grant, the Paycheck Protection Program, and there's a mid-size loan program that you can take advantage of. On the Paycheck Protection Program, and what's happening is the portals have opened up, so you have to go to the bank to make an application, and it's a bank that has been approved by the SBA. So we're counseling our clients to make sure that they reach out to their own banks because many of the banks are not taking on new customers. They're only processing these loan applications for their existing customers. Believe it or not, we've heard that they've been prioritizing loan and mortgage holders before they're prioritizing deposit customers. But in any event, you start with your existing bank to find out what you need in order to prepare an application for the PPP program, Paycheck Protection Program. This is a loan. It's a loan. It's backed by the SBA. It does not require a personal guarantee, and it does not require collateral. So, what's key here is it's based on your payroll costs, and it's a 2.5 multiple of your average payroll costs that you can apply for in terms of the loan amount. If you spend the monies properly, they will be forgiven. So let's just walk through a typical loan. So I prepared an application yesterday for a client. Their average payroll per month was $20,000. What goes into those payroll costs are, and right now every bank is different, but their payroll, let's say for last year, calendar year 2019, average payroll, $20,000 per month, including salary, your unemployment, so New Jersey unemployment taxes, healthcare costs, meaning healthcare premiums and other expenses, and pension. And so the total of those amounts on an average month came to $20,000. A 2.5 times multiple is $50,000, and that is the amount of the loan that you can apply for. The purpose of this loan is to get either to keep your current employees paid, or if you've had to lay people off, and they're collecting unemployment to get them back on the payroll and continue to pay them, because the federal government wants employers to keep their employees paid, keep the economy going, make sure that your workforce is retained, because keep in mind, to the extent that you're laying people off, you may not be able to get your workforce back. It's not going to be that easy to get them back necessarily, and to get you ready to be up and running once the quarantine is over and the economy starts to get back up and running. So once you make the application, you will get word from the bank that your application has been approved. They'll disperse the funds to you, and then you have 8 weeks from the date that you receive those funds to spend them on 4 cost categories. That includes payroll costs, which are those the same types of expenses that I indicated just previously. Utilities, which can include your gas and electric, your telephone expenses, your internet services, and rent. So lease payments for your space and or equipment leases, excuse me. And the 4th category is interest expense on mortgages that were in and loans that were in place prior to February 15, 2020. So you have an 8-week period to spend these dollars that were loaned to you in these 4 categories. And excuse me one second. In these 4 categories, with 75% of the loan amount being spent in payroll costs. So there's another criteria, and that is that loan will be forgiven to the extent that your full-time equivalent, and that's your employee base, either equals or exceeds what it was for the same period last year. So loan amount I talked about, you're allowed to spend on the 4 categories. 75% of the loan has to be spent on the payroll costs. And then you need to make sure that your workforce is back in place to the level that it was over a base period. And on a very simplistic basis, that is the payroll protection program in a nutshell. There's been a lot of confusion about what constitutes payroll. How, is your payroll base calendar year 2019? Does it start April 1st, 2019 and go through March 31st, 2020? Because those are the immediate 12 preceding months before you make the application. I'm not going to get into all of that right now, but there's just been a lot of confusion, and what it's really going to come down to right now is what the bank that you're applying at is asking for. I think the rest will be sorted out later. There's still a lot of information and confusion about the loan forgiveness piece. Just because of the way that this whole process has evolved, it's been very quick and very confusing. And we've been using our Society of CPAs and also the State Society and the American Institute of Certified Public Accountants. They have their task force that have gone back and forth with Congress, looking for intent, going back and forth with the SBA, trying to make sure that everybody's on the same page. What's critical is as people are applying now, the portals or the loan process opened up on Friday, April the 3rd. Didn't go off real well. It's been getting up and running over the weekend. However, it's first come, first serve. So once the money's gone, it's gone. So I would encourage everybody to really make sure they understand what their options are, what their cash flow gaps are, what programs that they can take advantage of. If you don't understand or are confused, reach out to your accountants, attorneys, and other advisors, the bankers, and ask questions. You're not alone, but just make sure you drive the process as opposed to the process driving you. So I think that kind of gets it in a nutshell. And again, as I said, we have a lot of resources out on our website at www.mercadian.com. There's federal, state, and local assistance available in addition to what Kim had talked to you about in terms of your own specific industry resources that are available. So I'm going to end it there. I could go on, but I won't. So thank you.
Kim, is there a list of centers that are open? Is there a way that some of the people who are participating can find that list to help families who may be, who are essential service folks and may need assistance?
So that's a great question. I would encourage all families and programs that have been designated as an emergency child care program, direct parents to the website childcarenj.gov/emergency so they can fill out their simple application and be approved. And that will inform payment for the emergency child care programs. And it's also an opportunity for us to be able to give families really good referrals. We don't want to send out a list, and so a family might be looking all through this list, and there will be providers that might not meet their needs. So we're encouraging, all families, all essential workers that need childcare to their first stop should be the application through that website, and then we can connect them to programs that'll meet their unique needs.
Great. Another one for you, Kim. Will you be paid if you're open, but your numbers are down? And so you're caring for the children of essential service employees, but your program had many more children before that. So will you be paid for those that are on subsidy for those children as well? So what are you being paid for?
Okay, so child care programs let me start here. Child care programs that are closed that currently care for children on the subsidy program will continue to receive payment based on enrollment of children in that program through April 30th. And 100% of the parental copay will also be covered. Okay, emergent.
Yep.
Okay, and then those that are designated as, an emergency program, they will receive the higher rate for, essential workers for those that are coming to childcare. I'm going to get back to you on the question of whether, they'll continue to receive the emergency rate and, the subsidy rate, let's say, for those kids that aren't coming. I'm going to get back to you on that. And then if you could disseminate the information. I just don't want to provide information that might mislead. But I can certainly get you that information and get right back to you. But the intent is to support child care programs the best way that we can, because we, now more than ever know that, how critical child care is to keeping the economy going.
Right. Terrific. And that you said it's based on enrollment, not attendance. Do you know based on what date of the enrollment? So
yes, March 16th, and payment through April 30th. And it will be, longer term closure policies, just like with emergency care, are being assessed. But at the moment, that's the date that we have.
Okay, terrific. And a question for Sherry. Can I apply for a grant if I closed before March 27 and don't have employees?
Yes, you can apply for a grant, because the point is that you're going to you've been impacted, and the thought is you're going to rehire your employees before June 30. And June 30 is that key date where you need to be back up and running.
Okay, great.
You really want to bring your workforce back. And again, you want to look at your cash flow projection. And if you think that you can afford to, with the loan, I should say, continue to pay your bills and bring your workforce back so that they're off of unemployment, you have your workforce and you're ready to hit the ground running when you're ready to open back up, then by all means apply for the grant. I have a lot of my clients are just finding work for their employees to do just so that they, anything that they can move forward, and they're keeping them paid.
Great. Another question for you, Sherry, is what if your bank does not offer small business loans? The application for the PPP requires that you have a business account with the bank. And there are some that we're hearing this as well, that some of the banks are not part of this part of the PPP. So what would you recommend for individuals in that situation?
Well, so that's tough and an interesting question. So, you got to start with your own bank, but if you happen to know any banks through, just through your community, I would check with this association. Is there anybody that any bank that, and maybe Patricia, you can answer this question, but do you have any liaisons that you could reach out to see who your affected, childcare provider agencies can go to? Or is there a particular bank that might allow you or allow them to apply? And then maybe just checking in the community to see. The SBA has a list of banks that are participating banks. So you can go out on the SBA's website and look to see who's participating.
Okay, great. Can family child care apply for these grants?
When you say family child care, what do you mean by that?
Programs that are run in homes, that are registered and are in homes. Can they apply for the grants?
I haven't really looked at that specifically. What they do ask a question that if you're a home-based business, I don't have the answer to that off the top of my head, but I believe that you can, as long as you are a sole proprietor or, a registered business. The fact that you're running it out of your home, I don't think is the overriding factor. I think it's that if you're a registered business and you're, filing a tax return every year, either as a Schedule C, obviously as a corporation, that's one thing, but or a Schedule C or an independent contractor. Everybody is able to apply, including Schedule C sole proprietors, partnerships, so partners of partnerships, and also independent contractors can apply.
Great. Kim, here's a question for you. Can someone be, as you know, there's been some significant staffing issues during this time period. Can someone be hired if they have never completed a carry or had a background check?
No.
Okay. Let's go back to Sherry. For a payroll calculation, do we use the monthly average of February 2019?
No, and again, this depends on the bank. So we've been going back and forth for 7 days now. There's probably 2 ways that you'll have to calculate it. Your bank's either going to ask you for calendar year 2019, or, for example, PNC that I applied through yesterday for my husband's business, they're using April 1, 2019 through March 20, 2020, because the Act initially said, the CARES Act said the 12 preceding months to making your application, which would be April 19 to March 2020. Some banks, though, are using 2019 calendar year.
Cindy, may I
Yes.
just elaborate
Sure.
on my definite no?
Sure.
I would encourage childcare programs to contact their local childcare resource and referral agency, because we do have, childcare professionals that are currently out of work. They are background checked and looking, looking for employment.
Right.
So we might be able to help them strategize, to meet their needs. So
Great.
I would encourage them to contact us.
Kim, here's two questions for you. How do we know whether the parent has correctly filled out the emergency application? And the second one is, do centers get a list of parents who have registered so that they don't accept the ones who have not registered?
Yeah, that's a very good question. They will receive authorization from us in the form of, a more official document to authorize the parent that they have been approved for payment. That's why it's so important to direct them to come, through the website, so then we can verify, authorize, and, and that puts the provider at ease that they will be indeed paid for caring for this parent's child, rather.
Thank you.
Mm-hmm.
Sherry, how about, here's another Facebook question. Are medical benefits considered to fit under the payroll category?
Yes, the cost of providing medical benefits. Now, you have to be careful. So if your employees are having withheld from their gross wages part of the cost of the benefit, that doesn't go into the cost. It's what the employer pays, including health insurance premiums. And they don't specifically define when it's called healthcare costs. So some people can interpret that to mean dental, vision, your regular healthcare premiums. It's up for interpretation. There's no one size fits all. So a lot of people are using all three categories. Some are just using healthcare costs.
Great, thank you. So here's a question that it's come up on every call I've been on late in the last week. Is it true that staff on unemployment will receive an additional $600 per week above their employment? That's more money than many of them are earning. Can you clarify?
That's what I've heard. I've heard the same thing.
So this additional $600 is coming through the CARES Act. And so that would be on top of what the unemployment insurance from the state level. Is that right, Sherry?
Yes. And then what's also interesting is I've had a couple of clients where they're sole proprietors and also officers of, for example, corporations. So normally you can't lay yourself off and you can't claim unemployment benefits, but the CARES Act has expanded the provisions for unemployment, and it's federal unemployment.
Right.
So even those people who normally would not be able to claim unemployment benefits at the state level can apply at the federal level.
That's right. Okay, so I think, one more for you. Are there insurance loopholes because of the virus? Sherry, I'm not sure what that means, but that was a direct quote.
Okay. Boy, I don't know what that means. Somebody'd have to elaborate on that. I'm going to say no, but but anything's possible.
Okay, there's still more coming in. So if you give me a few minutes to try to read them. Can employees of an emergency center reject returning to work and continue to collect unemployment?
Employees of them. So are they're rejecting coming back because they're concerned?
No, they prefer to accept unemployment because of the additional funding through the federal dollars?
I think that you have to go through the checklist. So if your employer is, if you can work, and you can work on site or you can work through, remote,
Virtually,
virtual work, remote work. I think you have to use your benefits first. They come first. So I have a DOL. There's this DOL checklist out there, which I don't have up in front of me. Let me just see if I can find it quickly. Here we go. Oh, that's not it. I'll come back to that. Let me see if I can find it.
Okay.
It gives you it tells you, and it's for employers so that they can clearly determine whether or not their employees are eligible for their, in New Jersey, their sick time, and they have to use their benefits, whether or not they go to unemployment, whether or not it's covered under workers' compensation, and whether or not it's covered under the Family First Corona Act.
Okay. Let's see. Can employees of an emergency center reject returning to work? Oh, I'm sorry.
That's the same one.
I'm
yep.
sorry. They're coming in fast and furious.
Yep.
Parents who are approved to send their child to a center, will they need to provide a current universal health form and immunization to the center?
That's a Kim question.
That's a Kim question.
Yeah, I believe immunization records are required, and I would also direct them to the guidelines that have been put out by the Department of Human Services. Department of Children and Families, Office of Licensing.
Okay, and we submitted an application with Chase and haven't heard anything. What do we do?
Chase Bank.
It says Chase. I think that's
okay.
Right.
So when you say submitted, well, if you submitted an application, they should have at the end of your submission confirmed that they received it. So at this point, I don't know that I would be having anybody looking for funding or any kind of information after that original submission and acknowledgement of the submission for several days.
Okay, so, but they should have got some kind of an acknowledgement that there was receipt of this submission, correct?
Absolutely, and
Yeah.
I don't know how Chase is doing it specifically, but I know 3 banks, including PNC Bank, you have to actually go online to submit your application. So you have to have a current login information. You're enrolled as a online banking, and that's how you do it.
Great. So you know what? One question I'm just thinking, Sherry, what you've already finished at least one application. Mm-hmm. What is the information that a provider needs to have in order to sit down and begin the application process?
So first of all, what I would do is I would recommend that you go out and if you don't have the final application that the SBA put out, if there's one on the SBA website, it's the final application that all banks are using. So that's number one. I would, bear with me. I've got somebody trying to call me through my computer. It's like, okay, go away. I can't make them go away. All right. They'll hang up eventually. Sorry. So it's interesting. Every bank is different, but I would definitely fill out a sample application form and have it ready. There are some unusual things that I wasn't ready for when I went online and to fill out the application. You need to have the date. Well, for PNC, I had to have the date that the business started. So you can get that off of your tax return or in the incorporation documents if you're a corporation. we needed to have the front and back copy of the driver's license of the person that's taking responsibility for the application, in a PDF so you could submit it. You need to have your 941 forms and your 940 forms from calendar year 2019 each quarter ready and in a PDF file and submit that. Paychecks, ADP, and most of the large payroll providers are creating reports that you can print out of their systems that you can then print to a PDF and on a monthly basis. I would be prepared to have information on a monthly basis to support entering information onto the portal on a monthly basis. Now, I hear some banks are saying, here, just give me the 1 year total, and other banks, you have to enter it month by month. So to the extent you can get your hands on how your bank is asking for the information, I would have it on a month by month basis so I'm ready for whatever information is requested. And then I say start with your application. If you're starting with that loan amount, be ready to support that loan amount with your payroll information and their copies of your healthcare invoices, and anything that's going to go into that base, including pension payments and things like that.
Okay, there's just a couple more, and then because I'm conscious of our time, respectful of your time and our participants. Sherry, can someone paid under the table that has claimed income tax get unemployment?
Claimed income tax. What does
I guess paid income tax.
Paid income tax. Well, if you're paid under the table, then I would suspect that you're going to have a fight on your hands with your quote unquote employer because
right.
They don't have you on the books. So right. I think you're out of luck.
Yeah. And Kim, can a grace period be extended to parents for getting immunization records and universal records since pediatric offices are closed?
So I'm just looking at that now. I think the intent here is not to, not to exclude people and be unreasonable. I think that immunization records do need to be submitted, but if extra time is required, that's reasonable. But again, I would definitely direct childcare programs to the guidelines. But
so,
yeah, I would say
yes.
We wouldn't exclude a parent from bringing their child to childcare if they didn't have their immunization records on day one. Does that make sense?
Mm-hmm. So let's just take a 30-second recap. This has been so informative. Thank you, Sherry. Thank you, Kim. For Kim, the takeaway is that centers that have been closed or are open only for emergency or essential service employees who accept subsidy will receive the subsidy based on enrollment of March 14th, I believe it was. March 14th?
March 16th, yes.
March 16th, and that the parent copay will be paid through April, and then the Department of the Division of Family Development is in considering what will happen after that. But right now, that funding will continue for subsidy. Terrific. That's great. And Sherry, what you told us was that the PPP, this federal grant, is first come, first serve, and that it is through the banks, and that providers should be ready and contacting their banks right now, and that there's lots that they need to get in order to complete the application, and you went through that list.
That is correct.
Right. So this has been terrific. As questions come up, we will try to get them to you. There's a few more coming in now, but I'm respectful of the time, and that we will try to answer those questions and get back to those who sent it. But I thank you for today. And for those of you who are on the call, on the line, we're happy you're here. And ACNJ plans to be having more of these. So please look out for future sessions, Facebook sessions that ACNJ and our partners will be holding. But for now, thank you. Stay safe, stay home, and we'll talk to you soon.
Thank you.
I know.